Welcome to the Sniff Spotlight Series, your one-stop shop to find out what's really going on in sniffs nationwide. I'm your host, Yitz Rubin, and this is sponsored by Renewal Rehab, the best therapy provider for sniffs nationwide. Welcome, Jonathan Burstyn, to the Sniff Spotlight Series. You're a administrator for the Bay of Burlington. So tell me about working in three different facilities as an administrator.
So one very interesting thing, you'd think that the long-term care industry would be streamlined, very universal, but one big shocker for me is doing interim work in different places was just really how different various operators implement various policies and procedures. Once you get that license and you pass that exam and you put it on the wall there, you just be careful there, don't get on that high horse so fast. There's still a lot to learn how each individual operator really provides oversight and implements their policies in different ways there. Even something as universal as the COVID pandemic about how to manage infection control was humbling, to say the least, to really relearn it as I went to different organizations.
So what would you say, working in three different facilities, what would you say are the specific challenges or differences that some operators are operating in over the others?
So one universal challenge, regardless how you operate, is staffing is just extremely difficult. During the onset of the pandemic, by the springtime, people were really scared to come to work, and that whole healthcare heroes thing was, could only go so far. And it's really the managers, the administrator, basically the whole non-clinical staff to basically be there for our clinical staff. Just to be their cheerleaders, getting them whatever they need, any non-clinical caretaking that needs to be taken for our residents. Everybody's rolling up their sleeves. There's nothing demeaning. They're passing meal trays, answering call lights. It becomes, since then, and it's probably going to be ongoing, anything that's a non-clinical job to do is really upon everybody in a long-term care facility.
So you feel like what would you say would be the difference in operation side? I understand that you had, there's, with the pandemic coming in, so there was a lot of, staffing was a big challenge. But let's say without the pandemic, what would there are different styles in operators?
Very different styles. There are those that are just, they want to see the bottom line. Let's just see the PPD on the bottom of the Excel spreadsheet. And if it's not, lower than a certain amount, figure out how to get it below that number. Which is, I see in the younger generation of operators. And then there's more of the old school operators who really see the day-to-day management side besides for the budgeting side, and will compromise and will give leadway towards the day-to-day operators, such as the administrators, of what things to implement, of where we could put more budgetary expense in and where we could loosen out as. But there are some operators are like, they look at the PPD, look at the bottom of the sheet, you didn't make that number, you got to figure it out.
Right.
So there's very different approaches.
Yeah, I mean, that sounds a little frightening to, at least for people to send their parents or loved ones to a skilled facility, is to really do research to say, hey, are they out for my best interests, or are they taking care of my loved one, or are they just into their bottom line?
So that's the difference between the operators and the actual frontline workers, and the administrator and the admissions director and the marketing director are the face of the organization. Our job is to build that trust and that confidence with our communities and our families, despite the limitations that we might have from our operators of what budgetary goals we need to make there. So we don't put on our business card, a place for your mom that we could spend less than X amount of dollars a day, but rather we have to build that confidence, and we know that we have a lot of very, very aggressive financial goals that we need to make while still maintaining that warm and trusting relationship within our community.
Yeah, I know things have been quite challenging, especially with regulations have been changing, and I mean it's always a highly regulated field. Would you say that there are anything specific that could be changed now that to make the care better, make it easier for operators to give excellent care to the elderly?
Yes, there's a lot of resident care and resident choice type of regulations. I'll give you one example. Well, very often there would be a resident that would want their bed to be by a wall. Many people I know when I was in school and college and yeshiva, but it happens to be that it's considered in most states, probably every state, it's considered a restraint to put a bed against a wall. You need to have a distance, or you have to have a guardrail. Basically make things more choice centered for the patient instead of black and white, what the rules are, what things that the people want, not necessarily what data would show you of what's safe or not safe.
I read a typical day starts with morning meetings with a report of overnight incidents.
Oh, it's a Mishpacha magazine article.
Yeah, that was you.
That was me.
Could you not interrupt me? This is my show.
Got it.
Mind your business. So I read in your article in the Mishpacha magazine, you're a seasoned writer, contributor to various magazines, and I read in one,
I made it to the centerfold in the summertime.
In the centerfold.
Yeah.
So a typical day starts with morning meetings with a report of overnight incidents such as work-related injuries, fall, or emergency discharges. What are emergency discharges?
Somebody codes or someone needs to go to the hospital for emergency. That means the complexity of the care that they need is greater than the services that we provide inside the nursing home. Obviously, within a long-term care facility, you want to avoid rehospitalizations as much as possible. Not because your Medicare star ratings go down, because when you send a patient back to the hospital, they're more vulnerable and susceptible to diseases, ammonia, let's just not say at least COVID-19. But when a complexity reaches to a point that the best interest of the patient is for them to go to the hospital, then yes, they'll go to the hospital. Clearly, if somebody's unresponsive, yes, we call 911. We did implement in our facility telehealth, where we have really it's like calling 911 really within really a push of a button on the cart that has a camera. We get a nurse practitioner and a doctor to analyze lung sounds, and based on their judgment there, we will send to the hospital.
Yeah. Seems like meeting you've got a personality. Do you feel like you're playing to your strengths, and are you able to remain cool under pressure, like when you're dealing with bed bugs and state officials at the same time?
It is very, very, very hard. I mean, you could have to fire somebody one day, do a performance improvement plan, and an hour later, walking around the halls, and you see aides sitting on their phone. You really just got to go, thank you guys. You guys are doing great. Room 202, call light is on. You need to have that very light, flattering atmosphere working in a nursing home. I mean, most clinical staff in a nursing home are working at least 3 or 4 doubles a week. They're extremely exhausted. It's a very, very draining job, and as administrator, you got to have that lively atmosphere of showing appreciation. Randomly just bring pizza, and in the morning bring that hot cocoa. But you need to also compartmentalize. Did I say that word right? Yeah, because you could have a reportable due in an hour. You could have a budget that you need to go over, and at the same time, you have 90 residents that need their care every single day. So you definitely have a lot of things that you need to be able to keep in order all at once.
Right. So you got to wear a lot of hats and really manage and be a great leader and manager of people, motivator,
cheerleader.
Yeah.
Yes.
I mean, I would love to see you in a little skirt with pom-poms if that would be possible.
So I did that once, but they didn't call the cops on me, but it was close. It was pretty.
Some of the patients died on the spot.
Some of the staff there didn't appreciate because I wore my birthday outfit also, so that's what happened.
So how has this year been different besides Santa Claus not being able to do his normal rounds?
I was actually Santa Claus.
You were
in
sent
the
to
nursing home. I dressed up as Santa.
How was that? Any
It
good
was very
presents?
nice. Well,
Any good presents?
gave out presents. It was good.
That's nice. I see you're willing to go the extra mile, even letting people see their dying relatives.
Yes.
So how has that happened?
Well, now most states do have compassion visits, but you know, it's someone's on hospice, especially now in the winter time. I can't have a family out in the window there saying goodbye to their loved one. But at the same time, you know, if this family has a visitor and someone else wants a visitor, so you'd have to do it very smart, very strategically. You know, do it at a time when not that many people are in the hallway. They'll come in one by one, say their goodbyes to their grandma, to mom, and it's heartbreaking. It is. No doubt about it. It is very, very, very difficult. But when the family calls me up and says, you know, it was just very meaningful that you let me in there, makes it worth it and reminds me what we're here for. What we're here for.
Do you have any specific stories of somebody, you know, like a story of someone saying goodbye to the loved one that was out of ordinary?
So just this past Christmas, December 25th, there was no activity staff in the building, but one family called me. They left a message on my voicemail, and I checked it. And for some reason, they really wanted to, all the cousins were together, and they wanted to do a FaceTime call to their grandparent. So I got in touch with one of the aides. They went into the activity room, got the iPad, and they did, there was 5 siblings, all with their kids. It was probably maybe 25 people, and they did a FaceTime call with their grandfather. And he actually passed that night. So that was, and I told the nurse who did that, and of course it was understaffed there, and it was one, you know, aide working in one wing by herself, and I really pushed her to go, you know, be by the bedside there for that 5 minutes. His name was John. Can't say his last name because of HIPAA, but he did pass that night, and it was just very, very comforting. You know, a lot of times they'll say, "Oh yeah, we'll do it tomorrow," but you need to remember in this business that. Same thing with admission. Admission comes in at 5 o'clock in the afternoon, and the housekeeping staff is, "Oh, can they come tomorrow?" So I always say the patient might be dead tomorrow. You know, that's another foundation that I try to implement on my team there. You know, an empty bed on Tuesday will always be an empty bed. You know, you can never have that on Wednesday. You'll never get that day back. So it's very important not to delay things.
Wow. Yeah, working so closely with people that are passing, I mean, I guess people in the sniff world are very aware of this. How does that affect you? Like, did you, coming in from another, starting, how did that affect you dealing with the elderly?
You gotta just enjoy every day of life. Remember that every day is a gift. Keeping yourself healthy. I mean, you look at a face sheet of a young resident, 60 years old, and you see, you know, obesity, smoking, COPD, so it definitely reminds you, you know, lifelong drinking, so definitely reminds you to keep yourself healthy, definitely keeps your health in check, but really to just appreciate what it is that you have, you know, count your blessings every day, and we have every day, I come home, I leave my phone in the car, the first, you know, 45 minutes when I'm home with my wife, my kids. Most days I do come home, my kids are probably usually sleeping already, but you know, Sundays, and of course, you know, one day a week, you know, I'm an Orthodox practicing Jew. You know, Joe Lieberman has a very, very good book called The Gift of Rest. And from sundown Friday night till sundown Saturday night, I'm totally unplugged, and it is a very, very rewarding experience.
What about family members that may have had a hard time being separated during COVID?
All right, so you just gotta be very empathetic, you know, feel the pain with them, and call them or see them in the parking lot of the facility and say, we are all in this together, and we are doing this lockdown to keep your loved ones safe. So it is difficult, I'm not gonna lie. It's very, very hard when families come by the door and they say, why is the delivery man allowed to come in? Why is the dialysis people allowed to come in? Why can't I come in? And they come in with their negative COVID results. It is very difficult, and there are times you have to be very diplomatic, you know, put on the Biden face or the Trump face, whatever it might be, and just reassure them that this decision is made not to piss them off, but really for safeguard the health of their loved one. And end off by saying we're just as annoyed with this policies as you are.
So as an administrator, with a personality, dealing with the staff and everything, do you find yourself ever getting connected to any of the patients and becoming friends with them?
Yes, of course. I have a handful of patients I speak to every day. I have actually had one resident, he had passed away a few months ago. He was a lifetime NRA member. He was like a military reserve guy. Yeah, so I am friendly with with quite a few residents, and you do get close with them, talk politics, and they're much older, so they all talk about, and I come in from Chicago, so they say, I hope you're not like one of those Democrats coming in from Chicago, and I got to bring my Trump hat inside there and reassure them, and then we talk guns, and we talk crap and everything, yeah, so there are these old-time vets that I get very close with.
The old-time Republicans.
Yeah, and happened to be Veterans Day, I did a whole presentation, wore a suit, had my American flag, gave everybody their awards. We did it like 5 at a time, and we had like 7 or 8 shifts. It was very fun.
Yeah, it sounds exciting. I mean, I would assume that it's a very fun home having you around as the leader there.
Yes, okay, it's a little, yeah. I guess you could say that it is, but there are times that when things get serious, I get pretty hot and heavy.
So you're also a firearms instructor. Do you help your residents with situational awareness?
So it's very complicated. It's very hard because I don't really like overlapping those two careers of mine. You know, like randomly when somebody comes out, it's like, "Yo, are you that Jonathan Burstyn that's a firearm instructor?" And like I have to like make sure to delete them on like all Twitter and Facebook. But no, I do not implement any in like with the activity department to like go to the shooting range with the ambulatory residents. I've thought of that, but I don't feel it would be for the best interest to take individuals, even if they're not on an oxygen tank, to a gun range. I don't find that to be appropriate. I'm not a geriatric physician, but just on my personal experience, when we are able to leave the facility, I think a trip to Walmart and to the ice cream stores on the facility van is
Right.
more than enough.
Right. So no driving of F-14. What are they called? The F-16 fighter jets, or you don't take them on those
No,
those tours.
no. Maybe if they're like private pay, maybe
Yeah.
possibly, but
But like Walmart or like bungee
Walmart.
jumping. No bungee jumping.
no bungee jumping. Their spines are too weak. They have stenosis from T1 down to T9. It's on impact. It won't be well for their optimal health.
Right. Have you had any security threats
You're asking me as a healthcare administrator or a firearm instructor?
as a healthcare administrator?
No, we have not. Our facility is very safe. There are times that the alarms, go off randomly. One of the biggest threat I would think for security in a long-term care facility is very often these buzzes and these alarms turn into background noise. So what I do is periodically, monthly, we change the alarm on the sound of the wander guards and on the doors. That's something that's very, very important people need to do because you walk in a nursing home and, like the courtyard door, the alarm goes off and just, it's background noise. So it's very important to change it up a little bit.
Right. So for people to be aware of that.
People to be aware of it. Exactly.
Jonathan, thank you so much for coming on and taking the time to meet with me. It was really a pleasure having you.
It's great to be here. Thank you so much.
Thank you for sharing this tremendously important part of senior care. The SNF Spotlight Series highlights healthcare heroes and thought leaders in the skilled nursing community. We're building awareness, trust, and shining the light on SNFs. So stay tuned. Remember to like, comment, and share.